Today's topic is you're never too young or too old for sciatica. It can get you. You got to be careful. So why do we do this? We do this to give you tools. As a result, you don't always know which treatment's best for you. Our goal is to give you more information so you can make better healthcare decisions. Today's topic is a 15-year-old female. This is case study 182. Oh yeah, I forgot about this. We're up to case study 1021. These are back pain and sciatica that went through our program, and this is what it looks like right here. That's what we're talking about. So this is 182 of 1021 total cases. 15-year-old female, back pain and sciatica. Now it's rare for a 15-year-old to have sciatica. Our average patient age is 53 years old. She was 15. On Monday, we're going to talk about a patient who was 95 years old, had sciatica. So you're never too young, never too old. Sciatica can get you. Now she was an athlete, she played a lot of sports, had sport injuries, but she didn't have one sport injury that caused this. She had the pain for a month when she came to see us, but she woke up with it one day. It's a rare event for a 15-year-old to wake up with pain down the leg, sciatica. But what happens is, when you're playing sports, all the sports cause wear and tear on the spine. And sometimes what happens is you can have an injury that over time gets a little bit worse, and as it gets worse, one day it kind of gives out. It's part of the degenerative cascade. So she had it for a month, but it wasn't as a result of an immediate injury. It was slowly over time, and then one day it just kind of gave out. Kind of the straw that broke the camel's back. So before coming to see us, she had physical therapy. Pretty normal. Injury, back pain, start some physical therapy. She was taking anti-inflammatories and also taking a muscle relaxant. She came to see us. She wasn't getting better with these other therapies. The outcome wasn't good. Why? Because it was a disc problem. We know sciatica is a disc problem. We have a 9-step sciatica solution. Part of that solution is identifying what's causing the pinching of the nerve. Typically it's the disc. So put her through an MRI. What we found out is she had a bulging disc. Well, bulging disc is a lot like a flat tire. I'm coming. A flat tire. What happens is the tire gets a little bit flat and the bulge of the disc pushes into, it's Friday. It's been a long week. So the disc bulges into the space where the nerve is, and it starts to pinch the nerve. Okay, we've talked about this. So she had a bulging disc, which makes more sense as a 15-year-old. But she also had sciatica. Sciatica is the pinching of the nerve that goes down the leg. So nerve starts up here in the low back, L4, L5, S1, all the way down the leg, right into here. So she had that as a result of the bulging disc. She had one of my case studies are getting away. She had one of the 5 causes. She had the bulging disc. There are 5 different causes. There's a video on that. It's a good idea to watch the video. But bulging disc is where you get that disc pushing in, like a flat tire, pushing into the spinal canal, causing an irritation to the nerves. Now, here's her story. Her pain was a 10. Her pain was a 10 on a scale of 0 to 10. 10 is as bad as it gets. It doesn't get any worse than that. It's about as bad as you can take it. She was taking the pain meds, she was taking the muscle relaxers, had gone through some physical therapy, not any better at all. Like 0 better. So the outcome of those other therapies was not good. Why? Because it was a disc. So back pain, leg pain was a 10. Her Oswestry Disability Index was a 70. Oswestry Disability Index is the level of disability that you have in your life. It's what percentage of your life is compromised as a result of the pain. She was 70% compromised. So 70% of the activities she wanted to do, she couldn't do. As an athlete, she could barely get out of bed. Now, typically 80 and above is bed bound. She was 70. She was at 70. Scored from 0 to 100, so she was pretty high. She was crippled. Crippling disability, okay? The pain was really compromising her life, and sciatica has a tendency to do that. It really gets a hold of you. So she went through our program. Again, we don't use any drugs. We don't use any medicine, okay? Went through our program, did some therapy. What we do is we take pressure off the disc. So if the disc looks like this, we take some pressure off, and then we do exercises. So it's unweighted physical therapy, taking pressure off the disc. We found by doing that, you can make the discs stronger and healthier and get them functioning better. And when they function better, then you feel better, which is most important. So she went through the program. At the end of the program, her pain was a 0. Leg pain was a 0, and her oswestry was a 0. So she went completely back to normal. And again, she had failed the other therapies. She had failed physical therapy, she had failed the medicines, and the muscle relaxants was no better. Put her in the program, took about 3 months. At the end of it, she was completely better, able to get back and play sports, live her life normal. What's the goal? What's the objective? Our goal is to let you know we do help patients that have serious disc problems. Okay, you're not too young, you're not too old. She was 15. We had another case study. The girl was 12. She had a herniated disc with sciatica. So you're never too young, you're never too old. You can have it any time. We help the disc. Doesn't matter how old you are, we can help you. If you like what you hear today, if you don't like what you hear today, doesn't matter. I want you to subscribe to our YouTube channel, and you can follow us on the little pink camera thing here. Instagram, I know that, and the Twitter. You can follow us on the Twitter. It's Friday. I'm going to be back tonight. We're going to talk about a patient that she'd had a fusion surgery and she did not get better. Now, we've talked about 3 or 4 patients that had surgery, and we have 50 case studies, and we're working on putting more of them together, of patients that have had surgery and not gotten better, and they come to see us and they get better. It's called failed back surgery syndrome, when you don't get better as a result of surgery. So we treat that as well. Pre-surgery, post-surgery, doesn't matter, we'll help you. So follow us, subscribe to us, like us, share our information. We have something different, it's better, it's very helpful, share it. Thank you, I'm done, we'll see you tonight. I think, because it's Friday. We'll see you tonight, 5:30, Chicago time. Central Standard.